How does a radiologist interpret a pancreas quart scan? Imagine looking inside the body to see the pancreas and surrounding areas in detail. That's what a radiologist does when they interpret a pancreas quart scan. They start by reviewing a special imaging protocol called a dedicated pancreas scan. This scan uses contrast dye injected into a vein to highlight blood vessels and tissues at specific times. The scan captures images during two main phases. The arterial phase, about 15 to 20 seconds after contrast injection, and the portal venous phase, around 35 to 40 seconds after. These timings help visualize the pancreas, blood vessels, and any abnormal growths clearly. The first step in interpretation is examining the pancreatic tissue itself. The radiologist looks at the size and shape of the pancreas, checking for any swelling or irregularities. They assess how the tissue appears on the scan, noting areas that look darker or lighter. Darker areas, called hypoattenuating regions, might suggest tissue death, inflammation, or tumors. By comparing how the tissue takes up contrast, they can tell if parts of the pancreas are healthy or if there are signs of damage or disease. Next, they focus on identifying and characterizing any masses. Pancreatic cancers often show up as less dense or hypoattenuating spots during the pancreatic phase. The radiologist measures the size of these lesions, looks at their edges, and observes how they enhance with contrast. Sometimes, advanced techniques like iodine mapping are used to better distinguish tumors from benign cysts or inflammatory masses. Vascular involvement is a critical aspect because pancreatic cancer often spreads to nearby blood vessels. The radiologist carefully examines the relationship between any suspicious mass and major vessels like the superior mesenteric artery and vein, the portal vein, and the celiac artery. They look for signs of invasion, such as narrowing, irregularity, or deformation of these vessels. Detecting vascular invasion helps determine how advanced the disease is and whether surgery might be possible. The radiologist also checks the tissues around the pancreas for complications. They look for fluid collections, signs of inflammation, or abscesses. In cases of acute pancreatitis, the scan helps assess severity by measuring how much tissue has been damaged or necrotic and identifying fluid buildup, which can influence treatment decisions. Interpretation isn't done in isolation. The radiologist considers the patient's symptoms, lab results, and any previous scans. If needed, they may recommend follow-up scans to monitor changes over time or after treatment. Their detailed report summarizes all findings, noting any suspicious areas, the extent of disease, involvement of blood vessels, and complications. This report is vital for guiding doctors in diagnosing, staging, and planning treatment for pancreatic conditions, especially pancreatic cancer. In essence, interpreting a pancreas quart scan is a detailed process that combines careful analysis of tissue characteristics, lesion detection, vascular assessment, and complication identification. Using contrast-enhanced, multiphase imaging helps ensure the most accurate picture possible. Always remember, for any concerns or diagnosis, consulting a healthcare professional is essential. They can interpret these findings in the context of your overall health and guide you toward the best care.